Hi, my name is Marisol Valdez. Welcome to Phlebotomy Simplified. Today we're going over Chapter 1, and it is Phlebotomy Practice and Quality Assessment Basics. By the end of Chapter 1, you should be able to define phlebotomy and describe phlebotomy services, list professional competencies and examples of job responsibilities for phlebotomists, describe the workflow phases or processes of laboratory testing and how the phlebotomist contributes in each phase. List at least 3 examples of healthcare workers that are involved in laboratory testing. Identify at least 4 major areas of a clinical laboratory. List skills for effective communication and describe the essential steps for a job search. Last but not least, describe the basic principles of quality and list examples of quality assessments and/or quality control measures for phlebotomists. Phlebotomists work with all members of the healthcare team. Here is an example of a hypothetical organizational chart for a hospital-based laboratory. These are typical clinical laboratory departments, but may vary slightly from one hospital to another. Phlebotomy practice and definition. Phlebotomy definition. Derived from Greek words phlebo, which relates to veins, and tomy, which relates to cutting. The definition is summarized as an incision of a vein for collecting a blood sample. Venipuncture is withdrawing venous blood sample using a needle attached to an evacuated tube system or other collection devices. Skin, dermal puncture, puncturing a finger with a specifically designed safety device to withdraw a small sample of capillary blood. How are blood specimens used? Diagnostic and screening tests, therapeutic assessments, monitoring health status. Phlebotomy practices entail assisting healthcare team, collecting and transporting specimens, learning all aspects of pre-examination or pre-analytic phase of specimen collection. Duties may range from all phases of laboratory analysis to specimen collection. Please see box 1-1 in the textbook. Professional competencies and certifications. High school diploma or its equivalent. Length of training varies from a few weeks to a few months. Employers often require phlebotomy certification. Some states require licensure. Please see Table 1-2 in your textbook. Professional character traits. Sincerity and compassion, emotional stability and maturity, accountability for doing things right, dedication to high standards of performance and precision, respect for patients' dignity, privacy, confidentiality, and the right to know, propensity for health and cleanliness, pride, satisfaction, and self-fulfillment in the job. Cleanliness and good health, along with a professional dress code, visible employee identification, and a smile provide a positive image. Working with team members, taking pleasure in communicating with patients, refer to box 1-4, Phlebotomy Career Self-Assessment. Professional and courteous communication with patients is an essential job function. Stress in the workplace. Refer to box 1-5, 10 tips for relieving stress. Find time to do your own thing. Socialize with positive, energetic people and look for humor in daily situations. Exercise and eat nutritious, low-fat foods. Take more control over the sources of your stress. Establish adequate sleep habits. Read interesting books. Listen to new music or watch interesting movies. Keep a journal. Occasionally go to a performance. Avoid harmful habits like smoking, drinking, excessive or unnecessary drug use. Do not be afraid to seek professional assistance when needed. Grooming and physical fitness. Good posture minimizes back and neck strain and conveys a sense of confidence. Grooming and personal hygiene. Physical appearance communicates a strong impression about an individual. Employers are legally required to provide personal protective equipment. We refer to it as PPE. This image shows healthy nails that are clean and not too long. Nutrition, rest, and exercise. Phlebotomy requires physical stamina. Good health improves the healthcare worker's appearance, attitude, job performance, and ability to cope with stress. Communication strategies. Verbal, the actual words that are spoken, the pace and tone of your voice. Nonverbal, body language and gestures. Active listening, using verbal and nonverbal information to assess the information. Now it's time for a live exercise. Here we have the patient to healthcare worker communication loop. Pretend the healthcare worker is the sender of a message to communicate to the patient the receiver. He conveys the message using verbal, written, and/or nonverbal codes or sign language based on the knowledge about the patient and the urgency and the importance of the message. The patient will understand or decode the message correctly if he or she is familiar with the verbal or body language of the healthcare worker. Feedback provides evidence that either the message was correctly received or it was misunderstood. If the patient did not understand correctly, more communication is needed. Note the many factors that can interfere with even a simple message. Now we have the basics of communication. Show empathy for waking up a patient, disturbing him or her, or interrupting a meal. Show respect for a patient's privacy, confidentiality, condition, and family members. Build trust. Maintain confidentiality. Explain procedures clearly. Tell the truth. Establish professional bond. Use common courtesy. Show interest. Listen actively. Face the patient. Maintain non-judgmental posture. Lean towards the patient. Establish eye contact. Relax and listen intently. Provide specific feedback about the patient's behavior, procedure, and what the patient has said. Verbal communication. Convey the right message in a professional tone of voice using appropriate language. Language. Use simple, everyday vocabulary, particularly with children. Sensory impairments. Deafness or blindness. For hearing impaired, use pre-printed instructions or write down instructions. Seek feedback for understanding. For sight impaired, communicate identity and what he or she is doing to the patient. Languages other than English. Use an interpreter or translation services, nonverbal cues, pre-printed cards in languages other than English. Environmental noise can result in an unclear message. Age. Be sensitive to word usage, pace, tone, and volume of voice. Use a calm and soothing and confident tone of voice, not too loud, not too soft. Emergency situations. Require extra speed without jeopardizing the personal touch. Bedside manner, pleasant facial expression, neat appearance, and professional manner. The patient encounter. Knock gently on the patient's door. Introduce yourself. Inform the patient of why you are there and that the blood specimen collection was ordered by their physician. Remain calm, compassionate, and professional. Let the patient know how the procedure is going. Do not be distracted from phlebotomy procedure by excessive talk of unrelated issues. Before leaving the room, discard, remove all supplies and equipment. Double check the identity, secure your specimens, and thank the patient for cooperating. If the patient is hospitalized, a match should be made between the test requisition or labels and a unique identification number on their armband, and by a verbal confirmation from the patient. If hospitalized, the patient does not have an armband, a positive confirmation must be made by a unit nurse who knows the patient. This process should be well documented by the phlebotomist. Special identification procedures should be well documented for ambulatory patients, especially in cases of homebound patient, mobile vans, or other off-site locations. This information should be confirmed by the patient prior to the blood collection. Introduce yourself and clearly explain the purpose of the interaction. Direct the patient to sit in a chair with sides or arms to recline during the procedure. Take extra time to find the nearest bathrooms for hand washing and bed in case of fainting. Bring a mobile phone or computer to clarify laboratory orders or patient information. Fully explain the procedure to the patient. Identify the patient meticulously and cautiously using various methods. After the procedure, care for the puncture site and make sure the patient is not bleeding and is physically fit to leave. If the patient is homebound, make sure that he or she is no longer bleeding and is able to stay by him or herself. Role of the family, visitors, and significant others. Presence can make the patient more secure and comfortable. Sometimes they are more difficult to deal with than the patients. Physicians, priests, and chaplains have the right to visit patients privately. Consider the patient's privacy and safety and the confidentiality of patients' records. Nonverbal communication, positive body language, smile, eye contact and eye level, face-to-face communication, zone of comfort. Please see the tablet 1-4 in the textbook. Negative body language, distracting behaviors, wandering eyes, nervous behaviors, breathing pattern, crossed arms, a wrinkled forehead. Frequent glances at a clock or watch, rapid thumbing through papers, chewing gum, yawning, or stretching. Nonverbal communication can be positive or negative. Note the effects of each look, eye expression, and body language. For most Western cultures, there are 4 zones of interpersonal space. Intimate space, direct contact up to 18 inches, personal space, 18 inches to 4 feet, social space, 4 feet to 12 feet, and public space, more than 12 feet apart. Culture, a system of values, beliefs, and practices that influence an individual's concept of reality. Influences decisions and behaviors in many aspects of life. Active listening helps close the communication loop by ensuring that the message sent can indeed be repeated and understood. Listening skills can be learned and practiced. Listening carefully to the patient can have important ramifications in test results. Guidelines for telephone communications. Incoming calls. Answer on the first ring. Identify yourself and the department or doctor's office. Smile as you answer. Speak clearly and courteously. Ask how you may help the caller. Incoming calls. Acquire information from the caller using proper etiquette and record the date and time. If you cannot provide the proper response, ask for assistance. Before putting the caller on hold, give the caller an option to hold or leave a message. Don't keep the caller on hold for more than 30 seconds. Read the message back to the caller. Allow the caller to hang up first. Outgoing calls. Be prepared. With message pads, telephone setup, do not call to socialize. Use discretion with confidential information. State your name, where you're calling from, and the purpose of your call. Leave preferred times and phone numbers where you can be reached if a follow-up is needed. Thank the receiver for taking your message. Email communications. Consider legal documents and are admissible in court. Use in a professional manner only. Follow the facility's policies for authorized use. Reply in a timely manner. Assure the patient confidentiality. Avoid offensive language or excessive symbols. Quality basics. The quality of phlebotomy services involves organizational structures, processes, outcomes, and customer satisfaction. Phlebotomists have greatest impact on constant improvement of the services provided to stakeholders or customers. Quality improvement efforts for phlebotomy services often involve evaluating the following: healthcare workers' technique, complications such as hematomas, recollection rates resulting from contamination, multiple sticks on the same patient. Examples of stakeholders, customers in healthcare. Internal stakeholders are individuals or groups within a healthcare organization. External stakeholders are individuals or groups outside the organization. External stakeholders, local community, insurance companies and employers that pay for services, grant agencies and/or foundations, federal or state agencies, accrediting agencies, the Joint Commission, advocacy groups like AARP. Internal stakeholders, inpatients and outpatients, patients' families and friends, patient support groups, clinical laboratory staff, pathologists and other medical doctors, students, research staff, volunteers. A quality plan for phlebotomy services. Quality assessment for phlebotomy involves reviewing structures, processes, outcomes, and customer satisfaction. Tools for performance assessment. In a laboratory, check sheets, run charts, and statistical tests can be used to review both the analytical and non-analytical processes of the laboratory. Flow charts, Pareto charts, cause and effect, called Ishikawa diagrams. Flow chart example. Here's an example of a flow chart. Here is an example of a Pareto chart. Pareto charts tally the number of times each specified problem occurs. Letters across the bottom indicate the reasons for cancellation. For the example, the patient was unavailable, supplies were not accessible, and documentation was incomplete. This is an example of a cause and effect diagram. A cause and effect diagrams demonstrate interactions or factors that influence an outcome. For example, this cause and effect diagram demonstrates the issues affecting response time. Tools for performance assessment. Plan, do, checked, act cycle, PDCA. Line graphs, histograms, scatter diagrams, and brainstorming. Brainstorming exercise from box 1-13. Break into groups of no more than 3 or 4 people. One group takes the viewpoint of a new phlebotomist. Other group takes the viewpoint of the patient. Consider the idea of excellence or perfection in a phlebotomy encounter. Brainstorming exercise. What quality factors are important from your point of view? List all ideas and discuss as many ideas as you can in about 10 minutes. Come to a consensus about the order of importance of the factors. Compare and discuss the list from each group's viewpoint. Basic requirements for a quality specimen. Using standard precautions, identify, assess, and properly prepare the patient and avoid medication interference if possible. Collect specimens from the correct patients in the correct order and label appropriately. Use correct anticoagulants and preservatives and collect a sufficient amount of blood. Use devices that minimize needle sticks. Handle specimens carefully to prevent damage and/or hemolysis. Collect fasting specimens in a timely fashion and verify that they are actually fasting samples. Correctly time and document timed specimens. Allow specimens without anticoagulatives or additives to stand a minimum of 30 minutes for complete clot formation. Transport specimens to the clinical laboratory in a timely fashion within 45 minutes. Important factors affecting quality. Anticoagulants and preservatives, the correct order of draw. Mix specimens with the anticoagulant. Pay attention to shelf life and the expiration date of your supplies. Store specimen tubes correctly if not tested immediately. Monitor the number of blood collection attempts. Monitor blood loss due to phlebotomy, iatrogenic anemia. Thank you. That is the end of chapter 1.